Now, what about your success rates that you're having at the clinic? I mean, how many patients are you seeing? Are they coming in pre-chemo, post-surgery, post-chemo? Like, give me a kind of snapshot of the people that you're seeing and what kind of results that you're having in your clinic compared to the kind of allopathic Western medicine approach to cancer treatments.
That's probably the most common question that we get when people call our office. What's your success rate? Being an alternative clinic that sees people with cancer, we have to be very careful with our language. So we do not say that we treat cancer. From a medical legal standpoint, I believe you have to be an oncologist to treat cancer. So we treat patients who have all sorts of diseases. Now we specialize in people that have a disease called cancer. Our success rate, so let's take a step back, how medical profession measures the success rate with cancer is after their diagnosis, how many of these people with this exact type of cancer post-diagnosis are still alive after 5 years. They could die one day after 5 years and they would still be listed as cured. See, they could live a horrific life for 5 years and they die one day after 5 years and they're still listed as we cured that person.
Oh, wow. Even if the cause of death was that disease?
Yes. So it's a little skewed and you get a lot of rubber numbers out there with the success rate of cancer. The only honest way to measure success rate of cancer is quality of life. And for one aspect, I do not believe anybody's ever cured of cancer. Now, people will argue with me with that. No, God cured me. I don't have any cancer in my body. And that may be true. I do believe we're a spiritual clinic. We believe that God is your only healer. But we also believe that God can do anything he wants to do. But we also believe that you always have cancer cells, even if you don't have...
Right. You just talked about this earlier, right?
Exactly. Even if I don't have a diagnosis of cancer, I have cancer cells. So you have to always be treating as if. And assuming that I do have that and constantly, you never quit. So when we use the Rife, all of our patients go home with the Rife, for instance. And people will ask, when can I stop using that? And the answer is never. You're going to use that the rest of your life. And same thing with, when can I stop not eating junk food?
Right.
And the answer is never.
Never.
Doesn't mean you have to use the Rife every single day. And it doesn't mean you have to eat a perfect diet your rest of your life. You can cheat and you can still enjoy life at times, but your sway of your lifestyle has to be tweaked. And you want to keep it that way. So that's the number one perspective. And then as far as success rates, we measure our success rates with most of our patients come to us. I'd say probably about 70% right now come to us. They've already done chemo, surgery, or radiation, or some combination thereof. And then they seek places like us out. It just is what it is, because most people, they hear, they get a diagnosis of cancer, they're in shock. And they typically don't think, when the oncologists say you have breast cancer, their first thought isn't, I got to go home and research this and how I can take care of it.
They just want someone to tell them what to do.
That's right. And it is our human inclination to not want to take responsibility. I want the doctor just to fix me. So it's real easy to give your power over to somebody else who's going to take care of it.
Right. It's comforting. It's very comforting.
It is. And it takes a lot of pressure off of us, but it's also very dangerous. So we try to re-empower people in our practice that you need to be your advocate. We're here to educate you. We're here to help you. We're here to come alongside you, but we're not here to take the responsibility away from you. That would be disempowering, and that wouldn't be helpful for you. So again, most of our patients come to us that have already gone down the medical route. And the reason why they're coming to us is that it wasn't as successful as they wanted it to be. So a good percentage of those people are already given a time frame. Maybe we've had people with given 2 weeks we live near Mayo here, so a lot of people come from Mayo. They've been given 2 weeks or 6 months to live, and they're in dire straits. So part of, I believe, our responsibility is to reinstill hope that they don't have to listen to that no one knows their time, when their time is to go. They have to be, I'm big into being a realist, but it's very important to not let even the statistics that are out there to govern your life and to create fear. You have to believe that God has a purpose for you, and that your time is in His hands, and that there's ways to deal with this other than the medical profession that's out there. So that's a big part of our patients. I wish we had more like the 20 to 30% where they come to us, say, hey, I found out I have cancer. I want to do a natural approach as well, or start with a natural approach and only do the chemo and radiation surgery if I have to. My training is in integrative care, so I'm not against standards of care. I'm just against maybe gross uses of it. There can be benefits to chemo and radiation and surgery in certain types of cancer, but we might not want to use the big guns first. So if we can do more things from a natural perspective and change the person's lifestyle, I think we get better results. So our success rate is really based upon when you have a person that's, we, 20 some years of doing this, have seen people that have been given just weeks to months to live, and they live years later. I deem that as a success. So, and even if they still only live 6 months, their quality of life was so much better than being sick and ill and throwing up and just they can't enjoy their family and their grandkids. There just doesn't seem to be a lot of benefits to that either.